Mhm.
Thank you for joining Hawaii Wellness Network. Today we are going to talk about healthcare, which is a big topic right now. And I'd like to introduce our first guest. And you're with Global Healthcare Now.
Yes.
Yeah.
My name is Coburn Kuwata, and I've been in insurance field for the past 30 years, since 1980. And I got interested in healthcare, especially the rising cost of healthcare, both here and nationwide. And I got interested in this particular companies because of the services that they offer, but not only that, they're offering something that is very, very affordable, which is for a family up to 8 people, $69.95. And let me reiterate, this is not insurance. This is a membership-only program. And we have a lot of powerful benefits that we can offer, to the consumer for both insured and uninsured.
And one thing that was really exciting to me was I've heard a lot about the international medical tourism.
Yes.
So you actually have two parts to your insurance. It's local savings here, where you live, or if you wanted to, take advantage of the different countries that you work with, you can get procedures done there as well. So
That is
want to
correct.
talk a little bit about the
Yeah,
two
sure.
parts?
People has this misconception that GHC that here in Hawaii we have only prepaid healthcare, and which is doctors here, but they fail to realize that also internationally that we can have first-class medical facility at a very nominal cost. Example, there was a man in Louisiana in which he needed to get a quintuplet bypass.
Wow.
And the doctor said he was going to die, but it's going to cost him $130,000. What happened was he went to the website and he found a facility in Thailand called Bumrungrad Hospital, which is #1 in the world. And if you've been there, it looks like a 5-star hotel. And what kind of intrigued me was the cost for him to go there, and everything his cost was $12,000
Wow.
versus $130,000.
Now, did he have normal insurance, like medical insurance in the U.S.?
Unfortunately, he didn't have insurance. And and it's unfortunate that here in the U.S. right now we have close to 87 million people that has no insurance at all, because cost of insurance is has gone up significantly. And believe it or not, we're ranked 37th in the world versus the other country. France is ranked #1. So again, the amount that we pay versus the service, we have fallen. And that is so sad, because we have one of the we're looking at about a $2.2 trillion healthcare that we pay, and in the next 10 to 15 years, that's going to rise to $4.4 trillion.
Wow. So if you did get sick here, like
Yes.
you broke your leg or something like that, and you had a membership, how would that work? Do you have a list of the hospitals and doctors?
Yes, we do have a list of doctors, but what I tell my client is we do have a medical concierge. It's kind of unique. Like if you were to go to a hotel, you would pick up the phone, and what you do is you said, I would like someone to deliver something special. What we do is you call the 1-800 number, and the 1-800 number, you will have a professional that's going to answer your phone. You give your membership number, and they will ask you if you have a primary care physician and you're looking for whatever services that you look for. And they will go ahead and make the arrangement with the doctor, and they will have a negotiated discounted rate that they will be able to give you. And I would say so far, the amount of membership that we have has gone up significantly. I'll give you an example. There was a lady in New Jersey. This lady in New Jersey has Aetna life insurance, Aetna healthcare, in which what she did was she needed to take an MRI, and that would have cost her about close to $2,000. And with her 80/20 coverage, she would have her out-of-pocket cost would have been close to $500 to $600. She called GHC Now. GHC was able to give her the MRI that she needed at a cost of $340.
So it was even cheaper with her
Even
instead
cheaper.
of using her insurance.
So what she did, she went ahead and paid the $340. She got the bill, and what she did was she submitted to the Aetna, and she got another deeper discount. And those are some of the isolated cases. And we have a number of example of savings. Um, Everybody here needs dental, and one of the savings, in fact, we were talking to the audience, that a dental crown would have been $4,000.
It's very expensive for the implants.
Implant. We were able to give a $3,000 discount of $995 with what the patient would have paid.
Was that in the United States or
It was in the
international?
U.S.
Okay.
I have a friend who went to Costa Rica, and he wanted to take a vacation, so he had all his dental work. He took his family, and his cost was $3,000, and he was very ecstatic. And we take care of everything. We take care of the hotel accommodation, the travel. So it's very unique, and it's for the cost of $69.95, and this is for a whole family of up to 8 people. And the good part is they don't have to be in the same household. And so you might have somebody in San Francisco or New York. You can have them covered. All we need is their name and date of birth.
And what I really liked is, I was looking into international medical tourism and having some dental work done, but you actually research the hospitals and the doctors, so you're not, wiring money to, a company that you don't know.
That is correct.
Yeah. And how does that work? Like, let's say I pick a hospital in Thailand or Costa Rica. How does your company assist me on getting there and getting everything paid?
Okay. What we do is you call them medical concierge service. Then we have a medical tourism desk, and depending on the type of procedure, we set up an escrow account for you. Okay, we do not pay the doctor until the procedure is completed, and so you have that. I guess the feeling that that your money is safe because they will not wire the money until the procedure is completed, and in some cases, if you want it, we provide insurance for your procedure. And some of the well-to-do people, like NFL players, NHL, they use our medical tourism,
right,
because the service is first class.
That's great, yeah. And they get a vacation at the same time.
They get the vacation at the same time. And here's something unique. Here in Hawaii, you have one nurse in a station, and you have several orderlies. You go to Thailand or any of those other foreign countries, you have all registered nurses and 4 doctors that see you, and they treat you first class. And the rooms are, I thought it was a hotel room, because I made a mistake. Was when I was in Thailand, I was supposed to meet a business associate of mine, and I sat in the lobby, and my friend called me and said, "Where are you?" I said, "I'm at this hotel called Boomerang." I said, "That's a hospital." And I didn't know because there were shops and everything.
Wow.
Yeah.
So you get very good service.
Very good service. And Thailand is not the only one that's there. There's Singapore, there's Japan, Korea, a lot of different countries, including Australia and
pretty much every country.
Every
Last time
country.
I talked to someone with your company, they were looking into China. I don't know if that's gone through yet. Or...
China has gone through.
Wow, that's great.
In fact, I have a case, a friend of mine went to China, the son got ill, and so he was in the hospital for 2 days. They prescribed him IV medication, everything. Did you know what his out-of-pocket cost was? $10.50.
Wow.
And this was in Shanghai, China.
You can't get anything here for $10.
Absolutely.
Not even your copay.
Yes.
That's really exciting. And a lot of people don't know that there's a lot of American doctors that are working in the international hospitals and clinics because they don't have such a high insurance and malpractice insurance, where it makes it difficult to stay in the U.S.
You are correct.
So it's kind of a hidden secret.
Yeah, and that's a problem, because here in the U.S., because of all of the, hate to say this, but there's a lot of lawyers, and there's a lot of the doctor. I spoke with a brain surgeon, and he gets very risk averse because certain surgery he has to take a number of tests, because if something should go wrong, they can actually get sued by the attorney and the patient. In fact, I have some surgeon that's there in the 80s, and they still carry malpractice insurance. Believe it or not, they carry that until they die.
Just in case somebody.
Just in case.
That's scary.
A procedure that was done 30, 40 years ago. And it's unfortunate, but with GHC now, this company, we're able to help the large amount of consumers and being able to negotiate. Another unique thing about this is we can also negotiate your medical bill. So example, if you went to a hospital and you have insurance, and before you pay your copay, send your bill over to us. And we have cases like Polymomi Medical Center, in which we saved the patient an additional $300.
That's great backup, because sometimes it's hard to negotiate and you're getting lost in the billing system.
And because we are an advocate, so we can help a vast majority. And 9 out of 10 medical billing comes off fraudulent. I mean, they actually code it wrong. It's not a fault of the billing clerk, but everybody's human. But last year alone, there was over $10 billion of errors.
Wow.
Billing errors.
And a lot of people wouldn't know because you can't read those bills.
Absolutely.
And there isn't a lot of people to assist you.
Mm-hmm.
So, I've heard you worked with animals as well. Do you cover animals in the household yet, or?
Good question. Someone else asked me
My cat
that.
just had stem cell surgery, and it was very expensive.
I know it is.
Is that coming?
That is up for discussion. But at present, because what we're trying to do is we want to help the vast majority, and even here in Hawaii, we have so many people their full-time job has been cut to under 20 hours. And it's prevalent across the U.S. And people talk about Obamacare.
Yeah, of course that was going to come up.
Yeah.
Because a lot of people are nervous,
Yeah.
and I understand it's supposed to start in January, but they're going to hold back till October because it's not set up yet, or?
Well, let's put it this way. It's not going to be set up, and even if it is set up, there's going to be, statistics has stated that there's still going to be over 30 million people that's going to be uninsured. Okay?
Wow.
And because, there was a situation like Canada, is socialized medicine. And you will be basically sitting in front of a panel to get your medical procedures.
So you have to pass a
You have to
test.
pass a panel, okay? What's so unique about GHC now, unlike medical insurance, is we also cover things like elective surgery, cosmetic surgery, acupuncture, naturopathic, like chelation, and these are some of the few that we are able to negotiate and discount. And the good part is you have an opportunity, but not only looking in the U.S., but all 65 countries.
Right. And I know a lot of people are going overseas, especially
Absolutely.
for the alternative, and that's
Mhm.
a hard thing for me to pay for mainstream insurance.
Mhm.
When I usually go to naturopaths and chiropractor
Yes.
and acupuncturists, and they're not covered by the insurance companies, which you can help with those as well.
Absolutely, yes, that is true. I can bring up a case in which there was a former worker at Queens Hospital, a local hospital here, in which he worked for the company for close to 40 years, in which he retired at age 62, and a few days later he ended up having a stroke. And the unfortunate part was when you leave the system, in which I was quite surprised, he was not covered by healthcare insurance.
And his what is it, Cobra? Do they have insurance in the meantime before they find a new
But
job,
the
or-
cost of Cobra is about $1,500.
So it's much more than your
Much more.
insurance.
So again, he was able to get Medicaid, or they call here in Hawaii is Medicaid or Quest, and he was able to get federal help. But because there's an upward limit, the doctor said, "I'm sorry, we can't help you anymore because they're not collecting any money," and he's still not healed. With GHC, we were able to not only be able to give him a wheelchair that he needed, but we found a facility in China, okay, in which we will, it's a 90-day treatment, all expense paid, including airfare, accommodation, is both new medicine and old Chinese medicine. In the United States, it would be about $1 million. We were able to get him at $12,000.
Wow.
Very affordable.
Is there a waiting period, like when you sign up and let's say you want to get like a root canal done or something like that? Like some insurance or even Aflac, or I think it's 6 months to a year. Is there a waiting period for any services?
No, there's no waiting period. And one thing good about GHC now is even if you have pre-existing condition, pre-existing condition are things like you have cancer, you are covered immediately. Once you sign up as a member, They will give you a membership number, and you can call the very next day. If it's the weekend, you have to wait for Monday, and they'll be happy to help you.
It's a lot of people ask a little nervous about Affordable Care Act or Obama Act coming in and not knowing, because we still don't know how much they're going to charge us per month.
Yes.
So, and I understand, like 2013, that if you don't pay that monthly fee, there's a $1,200 fine, and then per family, and then 2016, it's a $12,000 fine. So if they set it at $500 or $750 a month, if you don't pay it, they fine you. So
you're absolutely right. There are talks about it, and there are lobbyists that are basically are fighting that, because it's unfair, and some of the benefits that they're trying to offer. Because I recently read the 2,565 pages of documents, and it is so convoluted that even the trained people that understand healthcare would not even understand it.
All right, so I think a lot of people are nervous because they just don't know. So this
Yes.
would be a good
This
backup.
would be a tremendous backup, because I tell people, why wait? Why wait when you can actually get the benefit now?
Right, because you can still have both.
You can still have the
Complement
both.
each other.
Yes.
Well, great. Well, how does someone get a hold of you if they'd like to get
Okay.
some more information?
There's the website here called www.ghcnowhawaii, right? And my telephone number is 808-306-6763.
Great. Well, thanks for coming on. And
Thank you very
that was
much.
very enlightening.
Thank you.